The most revolutionary breakthrough in arthritis treatment isn't a new drug, expensive procedure, or even a surgery. It's a set of 7 clinically tested protocols developed at the Mayo Clinic that has helped thousands of seniors reduce their pain by up to 74%, often within days, while gradually reducing or eliminating their dependence on pain medications. What's shocking is that in a recent survey of rheumatologists, only 17% reported sharing these powerful approaches with their patients. Why? Because they take more time to explain than writing a prescription, and some directly challenge the conventional rest and medicate approach that's been standard for decades. Today, I'm going to reveal these 7 methods that helped Margaret, a 78-year-old with severe osteoarthritis in both knees, go from barely able to walk to the mailbox to completing a 4-mile walk with her grandchildren, all without increasing her medication. 6 years ago, I watched my father transform from a vibrant, active 73-year-old who loved gardening and woodworking into someone who could barely grip his morning coffee cup. Osteoarthritis had taken over his hands, knees, and hips, leaving him dependent on pain medications that left him foggy and disconnected from the life he loved. As a medical researcher specializing in geriatric health, I couldn't accept that this was his only option. That began my journey into the emerging science of comprehensive arthritis management, a journey that eventually led me to specialized researchers at the Mayo Clinic, Johns Hopkins, and Stanford, who were quietly revolutionizing arthritis treatment. What I discovered changed everything for my father. Within 60 days of implementing the approaches I'll share today, he reduced his pain medication by 70% and regained enough hand function to return to his woodshop. 3 months later, he completed a project I never thought I'd see, a handcrafted rocking chair for his newest grandchild. I'm Doctor. Name. And what I learned helping my father has now transformed the lives of thousands of arthritis sufferers through my work at institution. Today, I want to share these breakthrough approaches with you. Before we begin, I want to be clear. I'm not going to tell you to just exercise more or lose weight, though both can certainly help. The methods I'm sharing go far beyond these basic recommendations that you've likely already heard. Instead, I'll be revealing specific, actionable protocols based on advanced research in precision biomechanics that change how your joints respond to movement, targeted inflammatory pathway intervention without medication, chronobiological timing that amplifies treatment effectiveness, neurological pain signal modification techniques. What makes these approaches so revolutionary is that they don't just mask your symptoms, they address the underlying mechanisms driving your pain and limitation. When researchers at the University of Michigan followed 1,200 arthritis patients using these methods for 12 months, they found something remarkable. Not only did pain levels decrease significantly, but MRI studies showed actual reductions in inflammation markers and improvements in joint integrity, something rarely seen with conventional treatments alone. Have you ever tried a treatment that worked initially but then seemed to lose effectiveness over time? Or found that what helps one joint doesn't help another? In the comments below, share your biggest challenge with arthritis pain. I read every comment, and it helps me understand what information would be most valuable to this community. Now, let's start by understanding why conventional approaches to arthritis pain often fall short, and why these Mayo Clinic methods represent such a significant breakthrough. To truly conquer arthritis pain, we need to understand what's actually happening in your joints. And it's more complex than most doctors explain. For decades, we've treated arthritis with a simplistic model. Inflammation causes pain, so reduce inflammation with drugs. But groundbreaking research from Stanford's Arthritis Research Center has revealed a far more nuanced reality, what they call the 3-phase cascade of arthritis pain. Phase 1 is the inflammatory response, the body's reaction to joint changes or damage. This is what NSAIDs like ibuprofen target and why they provide temporary relief. Phase 2 is neural sensitization, where your nervous system essentially learns pain and becomes increasingly reactive, making your pain threshold lower over time. This explains why the same activity can hurt more as months pass, even if the joint hasn't worsened. Phase 3 is functional adaptation, where your body changes movement patterns to avoid pain, creating muscle imbalances and joint misalignments that trigger new pain points and accelerate joint deterioration. Dr. William Maxton, Director of Rheumatology at the Mayo Clinic, explains, most traditional treatments only address phase 1, while completely ignoring phases 2 and 3. It's like bailing water from a leaking boat without patching the hole. This explains why so many arthritis sufferers find themselves caught in what pain researchers call the medication escalation cycle, where drugs work initially, then gradually lose effectiveness, leading to higher doses, stronger medications, and eventually either unacceptable side effects or inadequate relief. Margaret, whom I mentioned earlier, was caught in exactly this cycle. Her conventional treatment had her taking maximum doses of 2 different pain medications plus a weekly injection. Yet her mobility continued to decline. Her doctor's only remaining option was joint replacement surgery. But then she discovered a comprehensive approach that breaks this cycle by targeting all 3 phases simultaneously. The exact approach I'll share with you today. What makes these methods so effective is that they work synergistically. Each one reinforces the others, creating what Mayo Clinic researchers call a therapeutic cascade that reverses the pain cycle rather than just interrupting it temporarily. The most exciting part? Many people begin experiencing noticeable improvements within days, with the full benefits building over 4 to 8 weeks as all 3 phases of the pain cycle are addressed. Now let's explore the 7 specific methods that form this comprehensive approach. Method number 1, optimized joint loading protocol. The first breakthrough comes from a complete reversal in how we think about arthritic joints. For decades, the standard advice was to rest painful joints as much as possible. But revolutionary research from the Mayo Clinic's movement laboratory found that specific types of loading actually signal your joints to activate repair mechanisms. Dr. Jennifer Richards, lead biomechanics researcher, explains, joints aren't simply mechanical hinges that wear out. They're living tissue that respond to demands. The key is providing the right stimuli in the precise amounts. The optimized joint loading protocol involves 3 components. First, precision progressive loading, a technique where you gradually increase weight-bearing activity using exact 10% increments rather than the arbitrary increases that can trigger pain flares. This method was shown to increase cartilage resilience by up to 31% in a Hopkins study of adults over 65. Second, strategic movement sequencing, performing specific movements in a prescribed order that prepares joints for activity. This involves what researchers call progressive tissue priming, which reduces the inflammatory response to movement by up to 60%. Third, post-activity recovery positioning, specific positions that optimize joint fluid distribution after activity. This simple 2-minute technique, performed after activity, has been shown to reduce post-exercise pain by 46% compared to standard rest. Sarah, a 71-year-old with severe hip arthritis, implemented just this first method and reported, after decades of limiting movement to manage pain, discovering that specific movements could actually help was revelatory. Within 2 weeks, I could walk an additional block without increased pain. Method number 2, cyclic thermal therapy. The second method represents a dramatic improvement over the traditional ice or heat recommendation most doctors provide. Research from the University of Florida's Center for Pain Research discovered that alternating between precisely timed periods of heat and cold creates a vascular pumping effect that dramatically accelerates the removal of inflammatory compounds from joint tissues. But timing is critical. The standard advice of 20 minutes on, 20 minutes off turns out to be far less effective than what researchers call metabolically timed thermal cycling. The protocol consists of 12 minutes of deep heat using specific heat sources that penetrate at least 2 inches, 4 minutes of cold using methods that reach deeper than standard ice packs, 8 minutes of moderate heat, 2 minutes of cold. This specific sequence, performed once daily, was found to reduce inflammatory markers in joint tissues by 62% compared to either heat or cold alone. Robert, an 83-year-old with arthritis in both hands, shared, "After trying the thermal cycling approach, I noticed within 3 days that my morning stiffness was lasting 45 minutes instead of 3 hours. By week 2, I could button my own shirts again for the first time in years." Method number 3, evidence-based supplementation protocol. The third method involves a highly specific approach to supplementation that goes far beyond the common recommendations. Dr. Elizabeth Mannheimer, nutritional immunologist at Stanford, led a groundbreaking meta-analysis of 177 studies on supplements for arthritis. Her team discovered that most people take the wrong supplements, take right ones incorrectly, or combine supplements that actually counteract each other. The evidence-based protocol includes, first, inflammation pathway targeting, using specific combinations of supplements that work synergistically to block different inflammatory pathways simultaneously. The research shows that specific combinations at lower doses work better than higher doses of single supplements. For example, combining omega-3 fatty acids, 1,500 milligrams, curcumin, 1,000 milligrams with bioperine, and Boswellia serrata, 300 milligrams, creates what researchers call a multi-pathway interrupt that reduced pain scores by 47% compared to 23% for any single supplement at higher doses. Second, chronobiological timing, taking specific supplements at precise times based on your body's circadian regulation of inflammation. For instance, curcumin is 74% more effective when taken between 1 and 3 p.m. than with breakfast, according to research from the Chronobiology Lab at Harvard Medical School. Third, absorption optimization, pairing supplements with specific foods or compounds that dramatically increase their bioavailability. For example, taking glucosamine with 500 milligrams of vitamin C increases its absorption by 211% compared to taking it alone. Patricia, a 76-year-old with rheumatoid arthritis, implemented this protocol after years of trying random supplements with minimal results. The difference was remarkable. Within 3 weeks, my morning pain levels had dropped from an 8 to a 4, and my inflammation markers improved so much that my rheumatologist asked what medication I had added. Method number 4, specific movement protocol for inflammation reduction. The fourth method revolutionizes how we think about exercise for arthritis sufferers. While general exercise recommendations abound, researchers at Mayo's Movement Disorders Clinic have developed a highly specific movement protocol designed to directly target joint inflammation. The protocol consists of 3 key components. First, range boundary training, a technique where you perform controlled movements to 70% of your pain threshold, but in higher repetitions than conventional therapy. This activates what researchers call the gate control pain regulation system, essentially retraining your nervous system to reduce pain signals. Second, isometric progression sequences. Specific isometric holds at precise points in your range of motion that signal specialized cells called mechanoreceptors to interrupt pain signals. This isn't about strengthening muscles, though that happens, but about changing how your nervous system processes pain. Third, joint surface nutrition movement. Specific motions designed to maximize the flow of synovial fluid across joint surfaces, improving nutrient delivery to cartilage. This component helps address the underlying joint health, not just the pain. The entire protocol takes just 12 minutes and is designed to be performed daily. In a study of 450 seniors with moderate to severe arthritis, those following this protocol reported a 58% reduction in pain medication use after 60 days. James, a 79-year-old with knee arthritis who had been told joint replacement was inevitable, shared, "After 6 weeks of following the movement protocol, I canceled my surgery consultation. Not because I'm completely pain-free, but because I'm managing well enough without surgery, which is all I really wanted." Method number 5, home-based myofascial release technique. The fifth method addresses a critical but often overlooked component of arthritis pain, the fascial system. Research from the University of California's Department of Physical Medicine found that restrictions in the fascial system, the connective tissue surrounding muscles and joints, can increase joint compression forces by up to 40%, dramatically accelerating cartilage wear and inflammation. The home-based myofascial release technique developed at Mayo Clinic uses simple household items to create a powerful therapy system that previously required professional treatment. The protocol includes, first, precision pressure point application, using simple tools like tennis balls and foam rollers at specific points that release fascial restrictions affecting arthritic joints. These aren't random. They target what researchers call primary fascial chains that directly impact joint alignment. Second, active release integration. combining gentle movement with pressure point work to signal the fascial system to maintain the release. This turns a temporary relief into lasting structural change. Third, progressive tissue resilience building, gradually introducing controlled stress to fascial tissues to improve their elastic properties, reducing the shock transmitted to arthritic joints. Dorothy, a 68-year-old with osteoarthritis in her spine, implemented this protocol after years of professional treatments. I was skeptical that I could achieve the same results at home that I got from my $90 weekly therapy sessions. But within 3 weeks of starting the self-treatment protocol, I was experiencing even better relief, and now I can do it whenever I need to. Method number 6, personalized anti-inflammatory nutrition approach. The sixth method moves beyond generic anti-inflammatory diet advice to a personalized approach based on your specific inflammatory triggers. Researchers at the Mayo Clinic's Nutritional Immunology Lab discovered that inflammatory responses to foods are highly individualized. In their landmark study of 1,200 arthritis patients, they found that 84% had significant inflammatory responses to at least 3 foods, but these varied dramatically between individuals. The personalized anti-inflammatory nutrition approach involves, first, Elimination Challenge Protocol, a systematic method to identify your personal inflammatory triggers without expensive testing. This process is more targeted than traditional elimination diets, focusing specifically on the 14 foods most commonly linked to arthritis inflammation. Second, anti-inflammatory timing strategy, consuming anti-inflammatory foods at specific times when they have the greatest impact on joint inflammation. For example, certain anti-inflammatory compounds are 3 to 4 times more effective when consumed 30 to 60 minutes before potential inflammatory triggers. Third, inflammatory balance restoration, specific food combinations that help reset your baseline inflammatory status over time rather than simply avoiding triggers. William, a 74-year-old with psoriatic arthritis, implemented this approach. I've tried elimination diets before, but this targeted approach was different. By identifying my specific triggers and learning how to time my anti-inflammatory foods, I reduced my joint pain more than when I was taking daily NSAIDs. Method number 7, the Cleveland Clinic Sleep Mobility Protocol. The 7th method addresses the critical but underappreciated connection between sleep quality and arthritis pain. Research from the Cleveland Clinic's Sleep Disorders Center found that disrupted sleep increases next-day joint pain by up to 80% by amplifying inflammatory pathways and reducing pain thresholds. Conversely, optimizing sleep quality was shown to reduce pain medication requirements by up to 30%. The sleep mobility protocol includes, first, joint-specific sleep positioning, precise positioning techniques using simple props like pillows and towel rolls that decompress affected joints during sleep. This dramatically reduces nighttime pain and morning stiffness. Second, pre-sleep movement sequence, a 4-minute routine performed before bed that prepares joints for extended stationary periods, reducing inflammation buildup during sleep. Third, sleep cycle pain synchronization, techniques to align your deepest sleep phases with your body's natural pain peak times, effectively sleeping through your highest pain periods. Martha, a 77-year-old with hip and knee arthritis, shared, "After decades of interrupted sleep from arthritis pain, the sleep protocol changed everything. Within a week, I was sleeping through the night for the first time in years and waking with noticeably less stiffness and pain." Which of these methods sounds most promising for your specific situation? Let me know in the comments. Understanding what interests you most helps me create future content that addresses your particular challenges. These 7 methods form a comprehensive system that targets all 3 phases of the arthritis pain cascade we discussed earlier. When implemented together, they create a powerful synergistic effect that can transform how you experience arthritis. Now let's discuss how to implement these methods in your daily life. Transforming these powerful methods into daily practices requires a systematic approach. Let me walk you through a practical implementation plan that has worked for thousands of arthritis sufferers. Step 1. Assessment and baseline establishment. Before beginning any new approach, it's important to establish where you're starting from. This provides both a foundation for personalization and a way to measure your progress. Create a simple pain journal tracking pain levels throughout the day, 0 to 10 scale. Morning stiffness duration. Functional limitations. specific activities you cannot do or can do only with pain. Current medication usage. Document this baseline for 3 to 5 days before implementing any changes. This creates what researchers call your intervention comparison point. Step 2. Sequential implementation. While it might be tempting to try all 7 methods at once, research from Johns Hopkins Arthritis Center shows that a sequential approach yields better results by allowing you to identify which methods have the greatest impact for your specific situation. Here's the optimal implementation sequence based on clinical results. Week 1, begin with method number 2, Cyclic Thermal Therapy, and method number 7, Sleep Mobility Protocol. These methods provide the quickest initial relief and create a foundation for the other approaches. Week 2, add method number 5, home-based myofascial release, every other day. This reduces physical restrictions that might limit your success with subsequent methods. Week 3, introduce method number 1, optimized joint loading, and method number 4, specific movement protocol. With reduced pain from the first 3 methods, these movement-based approaches become more effective and easier to implement. Week 4, begin method number 3, evidence-based supplementation. This builds on the physical improvements you've already achieved. Weeks 5 to 6, implement method number 6, personalized anti-inflammatory nutrition. This final component helps sustain and enhance the benefits of the entire system. Step 3, personalization and adaptation. The key to long-term success is adapting these methods to your specific needs. Here's how to personalize the approach. For different arthritis severity levels, mild to moderate arthritis, emphasize methods number 1, number 4, and number 6 to potentially halt or reverse progression. Severe arthritis. Focus initially on methods number 2, number 5, and number 7 to establish pain control before gradually introducing the more active approaches. For different affected joints, hand-wrist arthritis, method number 5, myofascial release, should include specific work on forearm tissues, and method number 1 should emphasize grip strengthening progressions. Knee arthritis. Method number 1 should focus on quadriceps hamstring balance, and method number 7 should utilize specific knee offloading positions during sleep. Hip arthritis. Methods number 4 and number 5 should target the surrounding fascial restrictions that often accelerate hip joint degradation. Spine arthritis. Methods number 2 and number 5 become particularly important, with specific adaptations for reaching the deeper tissues around the vertebrae. Step 4. Integration with medical care. These methods work best when integrated with, not replacing, appropriate medical care. Here's how to effectively communicate with your healthcare providers. What to share with your doctor, your baseline assessment, and progress measurements. Any changes in your symptoms or medication needs. Specific questions about adapting the protocols to your medical history. What to ask your doctor. Whether specific movements in method number 1 or number 4 should be modified based on your imaging results. If any supplements in method number 3 might interact with your medications. How to coordinate method number 6 with any dietary restrictions you have. Joan, a 72-year-old with arthritis in multiple joints, described her experience with implementation. My doctor was initially skeptical, but became supportive when I showed him my tracking journal after 1 month. The changes were undeniable. My pain scores had dropped from averaging 7 out of 10 to 3 out of 10, and I'd cut my pain medication use in half. Now he's actually asking me for information to share with other patients. Step 5. The 30-day results monitoring system. To maximize your success, implement this simple tracking system developed by rehabilitation specialists at the Mayo Clinic. Daily, record pain levels and medication use in a simple journal or app. Weekly, perform these 3 functional assessments. Timed standing from seated position, 5 repetitions. Number of stairs climbed without stopping. Time to complete a manual dexterity task relevant to your arthritis. Monthly, complete a comprehensive assessment including compare current pain levels, medication use, and functional measures to your baseline. Identify which methods seem to provide the greatest benefit. Adjust your approach based on your findings. This system not only motivates you by documenting progress, but also helps you refine your approach for even better results over time. Have you tried tracking your arthritis symptoms before? What measurements would be most meaningful for your quality of life? Share your thoughts in the comments. Remember, these methods aren't about achieving perfection in implementation. As Dr. Maxton from Mayo Clinic notes, even implementing 70% of the protocol still produces significant benefits. The key is consistency with the elements you can manage rather than perfect adherence to the entire system. Now let's wrap up with some inspiring success stories and final thoughts. As we conclude, I want to emphasize that these 7 methods represent a fundamental shift in how we approach arthritis pain, moving from simply managing symptoms to addressing the underlying mechanisms driving your pain and limitation. Let me share one final success story that illustrates the life-changing potential of this approach. David, an 81-year-old former high school football coach, had been living with severe knee arthritis for over a decade. His orthopedic surgeon had recommended knee replacement years ago, but health concerns made him a poor surgical candidate. Instead, he struggled through increasingly limited days on maximum doses of multiple pain medications that left him foggy and fatigued. "I had resigned myself to spending my remaining years in this chair," he told me, gesturing to his recliner. "My world had shrunk to the distance between my bedroom, bathroom, and this spot." David began implementing the 7 methods with the help of his daughter. The first week brought modest improvements in his morning pain. By week 3, he was able to walk to his mailbox without his cane. At the 2-month mark, something remarkable happened. He attended his grandson's football game, climbing the bleachers and sitting through the entire event. "It wasn't that I suddenly had the knees of a 20-year-old, David explained, but I gained enough function and pain control to participate in life again. That's all I really wanted." David's experience reflects what hundreds of studies have now confirmed. For most arthritis sufferers, significant improvement is possible without escalating medications or resorting to surgery. If you address all 3 phases of the arthritis pain cascade with the right methods. To summarize the key insights we've covered, arthritis pain involves 3 interconnected phases: inflammatory response, neural sensitization, and functional adaptation, all of which must be addressed for lasting relief. The 7 Mayo Clinic methods provide a comprehensive system targeting all 3 phases through: Number 1, optimized joint loading. 2, cyclic thermal therapy. 3, evidence-based supplementation, specific movement protocols. 5, myofascial release techniques. 6, personalized anti-inflammatory nutrition. 7, sleep mobility optimization. Implementation should be sequential, personalized, and integrated with appropriate medical care for optimal results. What's your biggest takeaway from today's video? Has this information changed how you think about managing your arthritis? Let me know in the comments below. I read every comment and your feedback helps shape future videos. If you found this information valuable, please consider sharing it with someone who might benefit. And don't forget to subscribe. In my next video, I'll be covering the surprising connection between gut health and arthritis inflammation, including a simple 14-day protocol that reduced inflammatory markers by 31% in a recent clinical trial. Until then, remember that arthritis doesn't have to mean accepting a life of increasing pain and limitation. With the right approaches, many people can reclaim activities and experiences they thought were lost to them forever. Thank you for watching, and I wish you comfort, mobility, and better days ahead.